Xin kính chào mọi người, đặc biệt những sinh viên đang tìm hiểu. Anh tên là Nguyễn Minh Quang, bên nước Mỹ, người ta từng gọi anh theo tên Joseph Win. Anh là một sinh viên thạc sĩ về trị liệu với âm nhạc và cũng là người nghệ sĩ violon từ trường Đại học Southwestern Oklahoma State University, hoặc được gọi là SWOSU. Anh rất vui mình được gặp mọi người. Trong 10 phút tiếp theo, anh muốn nói về một chút về rất mới mẻ. Anh sẽ nói về trị liệu với âm nhạc là nghề nghiệp, việc làm của anh. Anh sẽ kết hợp chủ đề này với sức khỏe tinh thần để kỷ niệm tháng dành cho sự nhận thức về sức khỏe tinh thần. Vì lý do là anh mời gặp mọi người, anh muốn giới thiệu về chính bạn, thân mình và làm sao anh gặp được cô mình. Sau đó, anh sẽ nói về chủ đề liệu pháp âm nhạc, lý do liệu pháp âm nhạc có thể ảnh hưởng đến sức khỏe tinh thần, và những cách mọi người có thể dùng âm nhạc trong cuộc sống hàng ngày để tự chăm sóc bản thân mình. Là một người Việt sống trên đất Mỹ, anh vẫn còn đang học tiếng Việt. Cho hết buổi thuyết trình này, anh sẽ nói bằng tiếng Anh nhưng sẽ có phụ để bằng tiếng Việt. So, I will talk about myself.
All right, so introduction to myself. I've played violin for about 12 years since I was around 11 years old. I love music and I always thought it would only be a hobby. So I wanted to study pharmacy, which is why I went to the school Southwestern Oklahoma State University, also called SWOSU. I did some work in the pharmacy. While I could do the work and make money, I wanted to do something more meaningful. So at my school, I found out that music therapy exists, and I was so curious. So I connected with the professor there and decided to try it out. I loved it so much, I switched majors. I realized music is so influential and can achieve health-related benefits. Then I graduated from SWOSU in 2021, majoring in music therapy and violin performance, after I completed a music therapy internship and decided to go to graduate school. Now I'm here. I'm quite lucky. I've gone so much here at this university, and I want to keep getting more. So, how did I meet Gomin, the dance therapist? I went to Vietnam last summer, and my family there asked me, will you ever live in Vietnam to do work? And they also said they'll help me find a wife. And I said, I don't know. But I thought about it, and I realized there's no music therapy in Vietnam. Can I even find work in Vietnam? And I found out there is music therapy in other Asian countries like China, Japan, Korea, Indonesia, India, Taiwan, Thailand, Hong Kong, Malaysia, even the Philippines. So I researched on what progress there is for music therapy in Vietnam. And in my research, I found there was someone doing dance therapy, and I sent her an email. I met with Goman over Zoom and learned about dance therapy, her work in Vietnam, and how she and I can work together. She even got to present at my school, Southwestern Oklahoma State University, and now I'm doing this video project for you guys to advocate for my work. So I hope to help spread music therapy to Vietnam one day. So that's my mission. Now let's talk about music therapy. Music has seen healing effects in many cultures, but we have been able to turn it into a practice and job. So our American Music Therapy Association defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. There's a lot of words here, but when we bring this down, we have a lot of goals, such as communication goals, academic goals, motor goals, musical emotional goals, organizational goals, and social goals. We use music experiences to accomplish these goals. Our practice involves a therapeutic relationship between the therapist and the client, and our work is based on evidence. There's a lot of research and studies that go into what we do. And next, music is also an avenue for communication. What I mean by this is, for some people who may not be able to communicate with words, we can do with music. We have a lot of nonverbal patients who may not speak well or at all, but they're able to follow us in music making. Lastly, music therapy is very individual. And what I mean by this is we work with many different individuals. This leads into my next point. So, who do music therapists work with? There is a wide variety of populations music therapists work with. We work with all ages from newborn to end of life or elderly. In this, we work with people with developmental or genetic disorders, with learning disabilities, individuals with mental health needs, which may also include substance abuse issues. We have individuals with neurological issues and rehabilitative needs, which may include traumatic brain injury, Parkinson's, stroke, physical disabilities, and acute and chronic pain. We may also work with individuals with cognitive diagnoses such as dementia, including Alzheimer's disease. We may see this all in a hospital setting with patients through the NICU, which is the neonatal intensive care unit, the PICU, which is the pediatric intensive care unit, or the ICU, which is the intensive care unit. We also have the end-of-life care, including hospice, palliative, and bereavement. So there's a wide variety of who we work with. We work with virtually anyone. But let's narrow it down to music therapy and mental health. So some might ask, what does music have to do with mental health? So to start, we'll list some of the mental health conditions we might observe. It includes anxiety, depressive disorders, ADHD, trauma, psychotic disorders, bipolar and related disorders, substance use and addictive disorders, feeding and eating disorders, and anger-related such as oppositional defiant disorder or antisocial personality disorder, psychopath or sociopath. In these, we may observe symptoms such as anxiety, depression, stress, low self-esteem, social isolation, attention deficits, or fatigue. So music therapists help in a variety of approaches or orientations. These are approaches for how we help our clients. So we could talk about each of these. Psychodynamic approaches incorporate a lot of verbal discussion and processing after nonverbal music experiences when clients respond symbolically via music reflecting what they are working through, as they may demonstrate self-awareness or reflection skills. Behavioral approaches focus on how someone acts. So music can condition, modify, and shape, reinforce, and extinct behaviors. Both classical and operant conditionings go into this, and techniques such as music as an antecedent or a consequence serving the functions of positive reinforcement, negative reinforcement, less frequently used, which are also include positive punishment, negative punishment, or strengthening the contingency are additional examples. Next, we have cognitive behavioral approaches. Here we focus on changing the thought processes that lead into the change of behaviors. If one may perceive or interpret the challenge differently, then they'll behave differently. This is more proactive as the client focuses on what they're in control of at the present moment. We then have humanistic, which focuses on the individual self, their free will, and unconditional positive regard. Everyone is unique, valued, and respected regardless of circumstance. With this approach, we believe that clients may know the most applicable solution and should be encouraged to participate in the decision-making process throughout the treatment. The therapist facilitates this instead of dictating the therapeutic process. And lastly, we have resource-oriented. It's another one we have. Here, the focus is on finding both internal and external resources to maximize therapeutic outcomes. This may include identifying positive thoughts, one's potential and limitations, social, political, and environmental resources, their impacts on health, and how music may help strengthen the desirable impacts. So these are some approaches we have in music therapy to facilitate mental health treatment. With that in mind, music therapy may be used for objectives such as processing emotion that alters our communication, thought processes, movements, motions, behaviors, expressing our thoughts and emotions verbally and non-verbally, all while providing safety, peace, and comfort. We also help with developing effective coping mechanisms, developing positive emotional behavior, improving interpersonal communications, and improving one's self-image. What would music therapy look like? We have a lot of ways to treat mental health. So we have lyric analysis, We would sing to select songs with lyrics that allow clients to relate to and reflect about life circumstances, and also develop mindsets and coping strategies to be able to handle their circumstances. We also have recreative and improvisational music playing. This gives our clients opportunities to express their emotions by improvising on an instrument. We may even have them self-process their emotions when we have them identify what emotions they played on their instruments. We have music composition or songwriting. When clients have thoughts and feelings they need to express, we put it in song form. I have helped make original songs with clients. Sometimes I've even done 12-bar blues. Sometimes we take pre-existing songs and substitute lyrics to have the song be about them. Next, we have guided imagery and music. This one specifically needs training from a GIM, music therapist. This one involves music sequences to evoke images, feelings, and memories and sensations in a deeply relaxed state of consciousness. So this one requires a qualification. This may include meditation and verbal processing, mandala drawing the music, or other processing exercises. Lastly, music may be paired with other expressive arts. We may pair music with dance and movement, which is similar to Goman's line of work. We may also pair music with exercise, poetry, and even art. So these are some of the ways that we use music therapy to facilitate mental health goals. Now, our last section, I was asked to include a music and mental health first aid kit, where one might be able to use music as a form of self-care. However, I want to leave a disclaimer. Music therapy involves a therapeutic relationship between a client and therapist. To be a music therapist, you have to have a bachelor's in music therapy, which includes 1,200 hours of clinical training and a supervised internship. So what I will be listing are therapeutic uses of music, but doing this does not mean you are a music therapist, nor are a person doing music therapy. And if one cannot focus on following these steps, it is recommended to seek a LPMT, or a licensed professional music therapist, or MTBC, music therapist board certified, or go to a mental health care facility for immediate attention. So I will go into the kind of these forms of self-care right here. One that we have is progressive music relaxation and music. This is to decrease stress, decrease anxiety, and increase relaxation. The first step is to find a comfortable place to sit or lie down. Then we would play a playlist with select songs for relaxation. I specifically picked Dance of the Blessed Spirits by Orfeo, Pathetique #2 from Beethoven, and Violin Concerto in E minor, second movement from Mendelssohn for this purpose. After, focus on your breathing. When you recognize it, and you focus on the rates of your breathing. After which, then you would focus on your attention on the following areas of your body one at a time. Make sure while you focus on one area, leave the rest of your body relaxed. You would focus on your forehead, your jaw, your neck, your shoulders and your arms and your hands, your buttocks, your legs, your feet, and your toes. In each of these, you would tighten your muscles in each group for about 15 seconds, after which you would release the tension over 30 seconds each. Another self-care approach that we have is guided music listening. This is also to decrease stress, decrease anxiety, and increase relaxation. You would find a safe environment to listen to music. Maybe you'll use headphones too. But you would play some songs that are empowering or inspiring to you. I have examples such as Girls Like Me Don't Cry by Thuy, You Anh Đi Mẹ, Anh Bang Bang Me by Phúc De, or Em Kong by Wu Tan Bang. But take this time to reflect and connect to the song and what feelings these songs give to you. And the last one I have is recreational music making. I don't have many specific steps for this one. Sometimes I'll just list the method. When I feel stressed or anxious, I may play familiar songs on my violin or my piano to relax. My teacher also tells me she may play scales or arpeggios or exercises from hand on her piano. But to play music is to help anchor us if times feel unstable. But these are the kinds of music exercises you may use for self-care. As I finish this, I want to remind you of the disclaimers about doing this. This is music for self-care. but it is not music therapy. And this is the end of my online music therapy and mental health workshop. I'd like to thank you all for following along. Music therapy is a passion of mine, and I'm glad to be able to spread it to you this way. As I work with Goldman in the future about spreading music therapy to Vietnam, I hope to see and connect with you in the future. I was also told to leave performances of my violin playing for your viewing pleasure. You may find those on my channel or in the description below.
Please get used to me because I am to be around. An hy vọng sẽ gặp lại sau nhé. Tạm biệt.